I think your mind is right now. And so what we're going to do is kind of pass it off to our friends at Sedera, who are going to be doing an amazing conversation about physical and financial wellness and what the importance of that is, especially right now during this time. So I'm going to pass it off to Erika, and I'll see y'all later.
Awesome. Well, Taylor, thank you so much for sharing your gift with us. I certainly entered in with you and needed that after a really impactful week. So such a gift to kind of jump in this space with you guys. As Dawn mentioned, we are going to share about thriving in your physical and financial health. And so I am actually going to stop sharing because I'm having a tiny technical challenge. Okay, with you still. Okay, awesome. So I'm going to not share my screen after all and just kind of walk you guys through what we'll be talking about today. So my name is Erika Kraus. I am the head of brand at an Austin-based organization called Sedera. We are a medical cost sharing community that provides a non-insurance and sharing-based approach for managing large or unexpected medical expenses. And what that means is that I get to work alongside some incredible people who are helping individuals and families, but also businesses find an empowered way forward in their healthcare costs. We all know that in today's complex healthcare landscape, it can be incredibly difficult to manage your health and your wealth at the same time. These days, the average American household spends twice as much a year on healthcare as what we spent 30 years ago. And that can put an enormous strain on our budget, but it also, when we're under more stress and our health isn't getting the attention that it needs, our livelihoods and relationships are impacted as well. So our healthcare costs and our health are obviously connected. And more often than not, women are presented with quite the conundrum. So the focus of this session is to support one another in thriving in both our physical and financial well-being at the same time. And what we truly believe is that there is a way forward in doing that. And so I hope that you find some encouragement this morning, that you take some nuggets away that you're able to apply to your life. We're presenting some ideas and best practices and solutions that we hope will really help you. So joining me today are some incredible women who are passionate about transforming the world of healthcare and empowering Americans, and particularly women, to build healthier lives. So I would like to introduce Jenny Agahamlian, who is the VP of Strategy and Public Affairs at our organization, Sedera. We also have with us two amazing physicians, Dr. Katie Keller and Dr. Katrina Iqbal. I want to, before we get too far down the road here, give each of them the opportunity to introduce themselves. As you know, we all have things that we do in our day-to-day life. We put our hands and our hearts to really good work, but we also are people who have a larger life than just our work. And I want you to get a snapshot into who each of these women are before we go much further. So Dr. Katrina Iqbal, I'm going to pass it to you to introduce yourself, and then you can pass the baton to the next person, if you will, just so I don't have to jump back in there and interrupt.
Sure, great. Thanks for inviting me to participate in this. So I'm Dr. Katrina Iqbal. I was born and raised in Texas. I got my bachelor's degree at University of Texas in Austin, went to medical school in Arizona, and then I finished my family medicine residency here in Austin. After working in residency, I did a few years in the traditional insurance-based model, and I soon realized how broken the healthcare system was. So instead of giving up in medicine in general, I researched and came across direct primary care. And so my husband and I opened our own direct primary care practice called Direct Med here in Lakeway in 2015. And it's just rejuvenated my my original passion for getting into medicine. This is the type of practice I always imagined myself when I first decided to go to medical school. In addition to running a practice, we have two small boys that are 5 and 3.5 that keep us busy. And thankfully, the practice has been growing not only throughout the US, but our own practice has been growing. And earlier this year, we were lucky enough to have Dr. Katie Keller join us, and she has been helping us grow the practice, and she's doing an amazing job growing and taking great care of our patients too. So I'll hand this off to Dr. Keller.
Hey. Hi, guys. All right. Let's see. Can you hear me?
Yes.
Okay. I have a 5-year-old child. This is Annabelle. This is my daughter. And she's really excited to say hello. Okay, now I'm going to tell them some other things, okay? So I grew up in Michigan and I went to undergrad up there and ended up going to Virginia for medical school. I'm an osteopathic doctor and was at the VCOM, Virginia College of Osteopathic Medicine, which is on the Virginia Tech campus. And then I ended up coming on down to Corpus Christi. That's what brought me to Texas. That's where I did my residency and have been practicing in Austin for about 10 years. So yeah, Katriny brought me into her clinic this year. And so this is all stuff I'm learning too, along with you guys. I'm kind of learning about how to fix the broken medical system and how there's not just one option. There's not just like the standard insurance. So I'm learning a lot along with you and I'm really enjoying it so far. I practice in a more holistic way. I try to really look at the whole person and we both do. And would you like to say hello? Yeah, I'm a big family person and she's going to go hang out with her dad.
No, I am.
Okay, thanks.
I am not.
I love it. Hey, everybody. I'm Jenny Agahamlian. As Erika mentioned, we work together at Sedera. I've been an Austin resident for about 30 years now, and my professional career has been in policy and advocacy. I started at the Texas Capitol and spent some time working for the Texas Medical Association and with an insurer for many years. And then I got burnt out, and not unlike Dr. Iqbal, kind of needed a change. And so my change was to be a stay-at-home mom for several years. And from there, I got really involved in the community. And recently, about 4 years ago, I got invited to have a conversation with the founder of Sedera. And from there, I just got really drawn into the concept of medical cost sharing. And here I am 4 years later, back in the workforce full time. So that's me.
Awesome. Thank you guys so much for sharing a little bit about yourselves. I am really excited about what we have to share with you because we want to name the challenges, right? But we also want to look at our ways forward. You know, in today's healthcare landscape, it was interesting. Each of these women kind of talked about their own kind of run-in with how frustrating it can be. And I know for each of us, we each probably have our own story of how challenging managing our healthcare costs and the complex system can be. For some of us, that might be around cost. The monthly costs or the large unexpected costs are hard to bear. For others of us, it might just be clarity, the confusion of trying to understand how to navigate the marketplace and networks and billing, et cetera, surprise bills, where to go, when, for what. And then access, I think for a lot of people and many of us, it seems like there's either no good options available or the option we get through our employer doesn't seem to meet our needs, or you're an entrepreneur and you're trying to figure out what in the world do I do? I'm starting my own business and healthcare has suddenly become one of the biggest drains on my everyday life. And so wherever you find yourself, we hope again that there's some things in here that you can glean from and that we're more than anything learning together. We'd love for you to pop your own ideas and thoughts into the chat. This is certainly something that it will take a community to solve and find our way forward in. And so hopefully we can do that together. Jenny, before I would love to ask you, you do an incredible amount of research in this space, and you're also a woman navigating this yourself. And so I would love you to share a little bit about how you see the systemic challenges that I just mentioned and that we could all name in our own various ways impacting women in particular.
Sure, Erika. And I'm just going to preface by saying it was such a lovely meditation, and I'm coming from such a calm place right now. And then I'm going to share demographics and stats with you that are a little bit jarring in comparison to that. So please know from my heart that I'm sharing this because I really want women to pay attention to the healthcare system and know that right now it may not be working for you, but that doesn't mean it always has to be this way. And hopefully what you hear today is going to motivate you to kind of be part of the change that we're hoping to see in the overall system. But with that said, as women, we are typically the big healthcare decision maker in our households. Mothers are responsible for 80% of the healthcare choices and care that their kids receive. And so because the majority of women are the caregivers, there's a really strong and compelling reason for us to pay attention to how the healthcare system works, and especially if it doesn't work. I come from a place where I've long held that the healthcare system is broken. And I kind of almost start with that assumption and assume everyone else does also. But I recently had a conversation with someone who's like, Jenny, the healthcare system isn't broken. It works really, really, really well for the people who are making a ton of money in the system. And they have compelling reasons to keep it complex and difficult to navigate because that actually benefits them from a business perspective. But the system doesn't work for patients because it's hard to understand costs. It's hard to be an effective healthcare consumer. Historically, women have had to pay more for the exact same health insurance policies as men, and that's recently changed, but only recently. From a business perspective, healthcare providers see women as the money generators. We incur healthcare expenses that are more than 80% higher than men. And historically, studies have shown that we have lower quality care and worse outcomes. In fact, I saw something recently that says women are less likely to be treated as aggressively because maybe we're not as quick to vocalize our pain thresholds or the things that we're experiencing. In the employer-based system where most of us get our care, women are also falling behind. Women disproportionately have jobs in employment sectors that are being adversely impacted by the pandemic and are being we're seeing more and more women lose their employer-based care than ever before. In fact, female unemployment has reached double digits this year for the first time since 1948. Women have not been such a small population or a share of the job economy since, our grandparents' age. So this is a really, really trying time for women, and it's disproportionately impacting our healthcare. And so it's also disproportionately impacting the healthcare that our kids receive as well. So I hope that's not too jarring, but I think what we're going to start talking through next is maybe some solutions, Erika.
Yes, really soon. One of the things that whether you relate to every statistic that Jenny shared or not, they are real. And as women, we have the opportunity to kind of band together and find our way forward. I do think that most of us can relate to making omissions in our life and our daily lives of like, oh, I knew I should make that appointment. In fact, there's an appointment on Monday I've been needing to go to for a long time, and I have canceled it 3 times. And I'm finally going. But I'd love to ask our physicians in the room, what do you see women skipping out on, and why do you see that happening? And beyond that, what are the barriers that you see kind of on a kind of the care side for women more than anything else?
So I'll chime in. So I know that in my practice, one of the big things that people will put off is preventative type care, like preventative mammograms, well woman exams, pap smears, routine annual labs. And there's various reasons why I hear that women are putting those off. Cost is a big thing. The unknown of the cost scares people. The time to go get these things done. And then there's a lot of women that are honestly afraid of what those results may show. I have a lot of patients, female patients, that they're busy, they're working moms, they're stay-at-home moms, they're taking care of family members, and they don't put themselves first as the caregiver. And they'll they'll ignore a lot of their ongoing symptoms because they're just like, well, I'm a busy mom. And so this is what a lot of people must be feeling. And so it's not that big of a deal for me. And so having a really good relationship with your primary care to understand what symptoms you're having and to be told that's actually not normal. We should probably check X, Y, and Z. And that can help kind of justify too why some women are feeling the way that they're feeling. And then also having the understanding of what, price transparency for what costs actually cost, and knowing that not every woman has to have a mammogram every year. And that doesn't always start at age 40. So knowing that and having that relationship with your primary doctor can help relieve some of the stress and anxiety with, what do I need to get done? What's the cost going to be? And in the direct primary care model, like, because we implement so much telemedicine, just, you don't always have to come in for every appointment. So just the time involved in getting that delivery of care is improved because you have a direct relationship with your doctor.
Oh, go ahead.
I would say I agree with all of that. And coming from, the insurance, like the standard insurance background, I think the thing I hear the most commonly is when someone's trying to get their health in control, or they're having an issue when they come in and they're so worried about, I hear this all the time, is that covered? I'll say, we should check this. And how much does that cost? When standard insurance, I have to say, I have no idea. I hope it's not a lot, but that transparency is so important, and it ends up, maybe not getting, the patient may not get everything that they need out of that worry. So I see that very frequently, and then definitely agree with the other things that Katrina said.
I think that is such an important thing to bring up, that question, is it covered? And just the fear of what the surprise might be, what the cost might be, what the kind of ripple effect of actually engaging care, from fear of the unknown of what you might find out to also fear of the cost. And then what would you do after that? I think those are all things that we can definitely relate with. I wanted to ask you this, because you mentioned this type of practice that you guys work in, you gals work in, direct primary care. And since we've mentioned it already, I think it'd be really great to kind of share, what is direct primary care, and why does that empower you to also empower your patients more than you had in your other type of fee-for-service practice?
Yeah, so it's a really good question. So direct primary care is basically a gym membership to your doctor. It's a flat monthly rate that includes your annual physical, annual blood work, treatment for any ongoing or chronic conditions, as well as for any like acute or urgent type visits. All of our patients have our phone numbers, so they can directly message us for any questions or concerns that can happen outside of an office visit. And thankfully, we were set up already with implementing telemedicine. So like I mentioned before, you don't always have to come in for an office visit to talk to your doctor and get medical advice. So that's the beauty of technology, is implementing telemedicine. I feel like this type of model really empowers people to take hold of their health, because you're talking directly to your physician. There's not a middleman. There's not, it really kind of cuts out the confusion and then the delay to have care. And so I always encourage my patients to reach out to me if there's anything that's concerning to them. And then if it's something outside of my scope of practice, then I'll obviously refer them out to the appropriate area. But I really feel like this model not only fosters that better access, it helps keep costs lower, but it also just has that continuity. Like there's no mid-levels. You're either with Dr. Keller or myself, and continuity is something that shouldn't be underrated, because that, just having a doctor that knows you and your doctor just helps foster better care.
But I feel like direct primary care, you mentioned it, I mentioned it, but this theme of empowerment, being able to actually pick up the phone and get what you need when you need it, to find out more about your health status than you ever had before, and to have that type of care without having to ask the question, is it covered, is truly powerful. And one of direct primary care is certainly one of the solutions and one of the things that we wanted to connect you guys with as an option in managing your care and building healthier lives because of the depth and the richness of the type of care you get when you have a relationship with a doctor like these amazing women. So many of the things that we are hoping to share, you'll notice, have this theme of empowerment today. And whether you're able to kind of leave the model that you're in and move to direct primary care practice or join a community like the medical cost sharing community is not the point. The point is that you are more engaged in your care than ever, and that you have more tools than ever in your hands to be able to build a healthier life and a more powerful life and live out and into all the things that you have in front of you. So what we want to say for any of you is that there is a way forward. The staggering and sad and overwhelming stats that are our reality in America today do not have to be our future. And we really, truly do believe that there is a way to kind of work our way forward. And so what we're wanting to do today is to talk to you about how to navigate the what ifs, the large, the scary, the unexpected, those things that we never want to hear and we desperately avoid finding out, and also the what nows, how to invest in our everyday care in a way that's cost effective and helping us build our health and our wealth at the same time, which many of us feel are very not congruent most of the time. One of the things that has happened this year is we've been navigating this pandemic. And this is, as many people have said, the word that we are all tired of hearing, unprecedented, but it's impacted all of us. There's not a single person that hasn't felt the impact. And there's been many, many challenging things from it. One of the silver linings in this year is that it has brought us back to basics. We're in our homes more, we're connecting intentionally with people in our lives more. And one of the other things that it has done is helped Americans become more engaged in healthcare consumerism, asking questions, Googling things. When economics are presenting more challenges, then we're engaging more, we're leaning in, we're asking questions, we're engaging in things we wouldn't have normally done, like telemedicine and things like that. So some of what we want to share is around this theme of empowerment and around this theme of healthcare consumerism. And so, Jenny, I would love you to share a little bit about, we talk about this a lot, we've already nodded to it in multiple places, but why do we think shopping or healthcare consumerism is transformational for where we are headed in the healthcare space?
It's a great question, Erika. Going to bring you a couple more little stats, but not as scary, although I think it's indicative of, again, this changing environment that we're in. A recent poll I saw indicated that more than half of the people who were polled don't really understand medical billing. They have very, very low financial literacy when it comes to healthcare and healthcare costs. And those numbers are even higher among younger Americans. But we're starting to see really encouraging trends towards healthcare consumerism, the idea that we're going to start asking questions. We're not just going to do that thing where we have the muscle memory where we lay down an ID card and then we don't ask any questions from then on out. We are seeing more and more people go online and start to ask some of the questions that Dr. Iqbal was saying, like, how much does this cost? Am I going to pay out of pocket for this? Is there going to be a surprise bill later? It's such a weird dynamic in healthcare where you have zero idea about the service you're receiving and how much they cost you and how much you're going to pay now versus paying later. There's no other segment of the economy where you buy something and then you get billed for it months later at a cost that you had absolutely no knowledge of. And that's starting to change. Price transparency is becoming a real policy objective in the United States. There are quite a few different new innovative companies that are popping up that are starting to take whatever cost information they have available and package it in a way that healthcare consumers can access. Communities, like you mentioned, are popping up, and people are starting to talk to each other and make referrals based on cost. Like, oh, I found, this wonderful direct primary care model and it cost me blank. And people are saying, oh my gosh, that's something I can actually now budget for. The idea that you could budget for your healthcare because you would have a certain known cost affiliated with this is something that people are starting to demand. And we're hearing it talked about more and more. And I'm encouraged that as this popular and as the need for this continues to materialize, we're going to see more and more options that pull back the veil and increase price transparency across the board. You mentioned back to basics. This is very much the way that healthcare originally was. It's the doctor-patient relationship. It's that direct connection, that conversation, and it's a simple transaction where there's not other parties involved and money going here, there, and everywhere, and no one knowing what's happening. We're just getting back to basics, and it's really encouraging.
One of the things that we have found, and I've been on a huge learning curve in the last several years, I think what we have all noted is that we've been learning more about our system. And as we've learned, we've become empowered with options. But I think one of the craziest things that we've all discovered as you navigate the healthcare system more intimately is that high cost does not equal high quality of care. And we see that in Austin, we see that in any city, that you could go down the road and get an MRI for one cost or get the exact same MRI for a completely different cost. I don't know if any of our physicians in the room would like to comment on that or add any color, but it's certainly something that I know we encounter every single day. And it's important for us to know that high cost does not equal high quality of care.
Absolutely, that's a true statement. A lot of my patients that are new to direct primary care and they're coming to see me, and I'm talking about referrals to imaging centers. One, they think that they have to meet like their deductible and file through their insurance, but a lot of times they have no idea that the cost for an MRI is a fraction if they're paying cash, and cash is king, right? So you always get a better rate. But the nice thing about having like a direct primary care physician like on your side is that we can kind of help be financial stewards for our patient and help direct them into like what the best cash rates are in town and who actually we have the best experience with for also providing that high level of service. And so thankfully, like I did my training here, so I'm very familiar with all the specialists in town and the different services that they all offer. But the direct primary care community, like we all band together, and we've been able to negotiate really discounted cash rates for labs, for imaging, even for subspecialists, referrals, for office visits, and even surgeries. You can pay direct, transparent pricing for major surgeries that give you VIP service, and you actually pay less. Like for example, so my husband has a day job and we get our major medical insurance through his job, and my older son needed his tonsils out last year, and our family deductible was like $6,500. And so we could either pay that $6,500 deductible and go through the traditional insurance-based model for his tonsillectomy, but we chose to go through Texas Free Market Surgery and had a board certified pediatric ENT do the tonsillectomy, and it cost us like $3,000 cash. And we got VIP service, and we didn't have to worry about these mystery bills coming in later. So it was actually more cost effective for us to use that service, and it was great.
I think that's so such an incredible thing to mention for us, because some of us, might be able to go the non-insurance route and do direct primary care plus medical cost sharing, but some of us might, like you guys, have their insurance through their employer, and you might be asking, well, how am I supposed to be a healthcare consumer if I've kind of been handed this card? And I think it's such an incredible testimony to, hey, even then you can still be a cash pay patient. I know certainly for me, knowing that prescriptions, you can negotiate your costs on prescriptions, which is one of the kind of things that some of us have maintenance medications that we take daily. Sometimes we get presented a pretty large medication with a certain illness, or accident that we face, and prescriptions are another place that no matter, kind of how you are navigating your healthcare, you have the ability to use a discount card like GoodRx or Blink, or there's a lot of resources out there. It's a quick Google search to find discount prescription coupons, but you can drive up to the pharmacy, present a discount, and watch your prescription go from 45 to 13 and beat sometimes the insurance price. So I think that's really, really cool to mention. I think if you're hearing anything, it's ask good questions, call ahead, find out your cost. Those are definitely opportunities available for you. So when we're talking about the kind of everyday stuff, the what now, like what we wake up and kind of put our energy towards in the everyday life, the preventative and the primary care. Dr. Keller, I have followed you on Instagram for quite a few years because I have an autoimmune disorder, and I'm learned a lot from your feed. And I know that you are invested in helping people live healthy and well in an affordable way. And I'd love you to share some of those tips on how to build a healthier life, which ultimately reduces your cost in the long run. So anything that you would like to share?
Yeah, thank you for joining me on there. It's fun to have another way to share with my patients and just the community in general. So yeah, I would say, and I just wanted to comment on from earlier with the DPC, I didn't chime in as a side note. I've noticed from being with them for a few months, it's kind of like having a friend who's a doctor, which is, I mean, I have, my friends that text me anyway, like, what do you think about this? Or what do you, and it's kind of cool because you get that friend relationship in a way where you can ask a quick question. So I think that's a really cool part of direct primary care. But yeah, for just overall wellness, so there's a couple of things that we're trying to do as doctors. We want to help you with longevity. We want you to live a long time, and we want to help with quality of life. So we're looking at both of those. And a lot of people have probably heard of like the blue zones, the areas of the world that have more longevity than the rest. And when we look at those areas, there's area in Italy, area in Japan, and an area in the United States that I'm not tech savvy enough to do screen sharing, but if you look up blue zones Venn diagram, there's a really cool list of things. And what you'll notice about these things is these things are free. You don't have, this is free medicine. These are things that increase longevity and quality of life that are what we're teaching our patients that will keep you healthier and in the long run lower costs. So in the center where they all meet, you've got your standard no smoking. So sometimes you need a physician's help to stop that, but that's an easy one if you're able to stop not smoking. A plant heavy diet, and just trying. There's so many different types of diets, and there's not one diet that fits all. Sometimes it's going to be more paleo, maybe more autoimmune protocol, maybe more vegan. And I particularly like Dr. Hyman's kind of hybrid model. So if you needed to find something that was sort of a happy medium on that, that's one of my favorites. But trying to get a nice plant heavy diet, constant activity. These places, people are walking more. That's free. You can go for a walk. You don't have to have a gym membership to have exercise. You don't even need to go to a yoga class. You can find so much stuff online. You can just stretch. You can try to remember your stretches from a sport you did in the past and just do your stretches, go for a walk. Social engagement and family is in that center. And so it doesn't take anything to connect. Well, it's a little harder now, I will say, with COVID, of course. But if you have a phone, you call your friend or you call your family. It's hard times and you may not always want to reach out. It doesn't always feel like an easy thing to do, but connecting with somebody is truly, it's one of the pillars of health. So community can be really helpful for that. And some of the other kind of cross sections, I just wanted to mention, I love this cross section between the Italy and Japan one. Empowered women is actually on this Venn diagram. Like, how cool is that? Like, that's their take home. So feeling empowered, and some of these tools we're going over today, I mean, knowing that you can use GoodRx. I was astonished when I saw you could get a medication for $10, just learning this stuff too. In that same one, sunshine, you can get fresh air, get some sunshine. That's an easy way to get, you want to be sun safe, of course, and avoid the highest UV, but getting a little sunshine is good for vitamin D, of course. Gardening was in there, getting your hands in the dirt. So these are all things that are free. You just need to go outside for a lot of them. And then with clean eating, if you need to make some small changes, if you want to eat organic, but it's too expensive, you can reference the environmental working groups, Clean 15 and Dirty Dozen. They come out with that every year. You can see what your safest 15 fruits and veggies are that you can purchase, and then avoiding the 12, the Dirty Dozen, which are going to be the highest levels of pesticides. Shopping the perimeter of the grocery store, trying to just get what you need. So when I first started eating really organic, when I was back in college and on a budget, I was like, these apples are twice as expensive as at the time, and there was a really big price difference. And I'm like, how am I going to afford this? And so what I realized was, when I was buying just whatever, a lot of that food goes to waste and you end up throwing stuff away. So I tried to be really mindful of just getting, I think I'm going to have 2 apples, this week, and not buy the huge bag, and really make sure you're using everything. So that's kind of a budget thing that you can do. Breathing exercises would be another thing that I would really recommend. You can find some resources online. My favorite one is the 4-7-8 breathing exercise. And I often will do this with my patients, even on virtual visits, because, there's let's just slow down. Everything's kind of so fast right now. But you breathe in deeply through your nose for 4, you hold it for 7, and then you out through your mouth for 8. So if you all want to do it with me right now, we'll breathe in deeply for 4. Hold, and then out. And you can just feel your heart rate coming down. That turns off the fight or flight system. If you do a few rounds of that, bringing the stress hormone down, the cortisol level down, will help with that. So that's free. Journaling or gratitude journal, that's another idea. If you try to shift your thought pattern, so a lot of us get stuck in, I have to do the laundry. I have to, join you guys this morning. But what I can say is I feel grateful that I get to join. I can feel grateful that I have, the resources to do laundry. And it just, that small shift can help you really enjoy your life more. And this year especially, we have so much mental health we're dealing with isolation and all that. So shifting your thought pattern can be something small, something free. If you want to dig in deeper, you can buy a book, or do libraries still give books out right now? I think maybe they clean them. I'm not sure, but you could probably find something online on mindfulness. So if you get a mindfulness book or something to kind of learn about that, that'd be a cost-effective way. So we try to empower our patients with these type of tools that are going to allow them to stay healthier. I could probably talk about this for an hour, but I'll cut it off right now. And these are some things that you can do that don't cost anything and will really help to improve your quality of life and your quantity, your longevity. So thank you.
Thanks so much. Wow. I, first of all, need to dig into the Blue Zone. That was really cool stuff. What we've been sharing about is kind of ways to navigate the what now, your everyday costs, in more effective ways. So things that have come up are building strong relationships with your primary care doctor. Direct primary care, if you have never heard of it, is an incredible resource. Encourage you to look at Direct Med, which is where these wonderful women practice, as well as these amazing free things that we all can do every single day to build a healthier life. Stress, as we all know, is one of the killers of our health. And so investing in reducing stress and building healthier lives make a huge impact. Also, virtual care is something that we recommend to a lot of people. Telemedicine, get on the phone, connect with your doctor, build that connection. what we want to spend a few minutes talking about is also how do you manage the large and scary and unexpected? And probably each one of us has a little bit of a different way that we're navigating that. We either don't have a plan, we do have a insurance plan, or Jenny and I are members of a medical cost sharing community. So there's different ways to navigate it. But what I'd like to take a little bit of time to do as we're kind of rounding this session out is to learn a little bit more about how to be financially savvy when it comes to navigating the large and unexpected. And so Dr. Keller or Dr. Iqbal, I would love you to kick us off here. What would be 1 to 2 things you would tell people when it comes to the large and unexpected, things to be mindful about, things to be aware of when it comes to the large and scary costs?
So my patients, I always encourage them to reach out to me for anything and everything because I always like to be the first point of contact. However, if it's like a true medical emergency, I always try to like inform my patients like when this is the time. Like you shouldn't even be bothering like messaging me if it's like life, limb, or eye threatening. You go straight to the emergency room or call 911. But sometimes there's like a gray zone, right? And people aren't really sure. So I always encourage people to reach out to me. And sometimes I can handle something either through telemedicine and using technology, or like, hey, come in later to the office later today, or I'll get you first thing in tomorrow morning. But even through the weekends, like I can save people an urgent care visit. Urinary tract infections are a very common thing that always happens on the weekends or at night times. And it's really uncomfortable if anyone's ever had that. And so a lot of times it's something I can really handle via telemedicine, call something in very easily, and it saves people. And it's people are usually very grateful that they have that access. So I always, again, it goes right back to having that relationship with your primary doctor. Obviously, direct primary care is not a form of insurance, and so we always like defer to like you guys for like a health sharing option, or talking to people about always having something for catastrophic coverage if it is definitely something outside of our scope of practice in primary care.
Great. And I know that, for many of us, sometimes it's hard to know when to go to the urgent care, when to go to the emergency room, when to call your primary care doctor. Direct primary care can kind of span more than most practices, all the way kind of into some of that urgent care stuff. But if you don't have a direct primary care practice, know where your urgent care that you're going to go to is. Like, it helps to know. I burned my hand recently. It was 9 p.m. and I didn't know where to go. And so I'm in the middle of like calling and trying to figure out costs and what I feel safe with in the middle of a burn accident. It was a really miserable night. I would highly recommend never being in that position. So kind of, even if you don't have a direct primary care practice, think about kind of where you want to go for your urgent care. And also, a lot of things you don't need to go straight to the emergency room for. The things Dr. Iqbal mentioned are certainly those things. So we want you to run to the emergency room if that's the case, but that's another thing to think about. Jenny, I would love to, if you have anything to add here. I know we talk a lot about tools and kind of what are the tools to have in your tool belt when the big stuff happens, or when you're planning for a big medical event. And I'd love for you to share a little bit about that.
Absolutely. Well, you can't underestimate the power of a personal guide through the process. So having a direct primary care physician, having that medical professional in your life that you can go to and have these conversations with, and who can help direct your care. We mentioned earlier that, costs differ for the exact same services just depending on where you go. And so knowing in advance where to go to get that cost-effective care is absolutely critical. In my line of work, I deal a lot with crisis communications. And so we always say, make a plan, work the plan. When you're in the middle of the crisis is a really bad time to try to be creating the plan. So, talked a lot about all of these new tools that are coming online, different organizations that support this membership-based medical model, like direct primary care, like medical cost sharing. Planning ahead, putting yourself in a position to succeed when unfortunate and unexpected happens, I think is absolutely critical. I know that the pandemic has created lots of time for us to all be at home and to spend time reading and researching. I find myself constantly being targeted via Instagram and other places with devices and ideas that I never knew existed. And I will find myself 30 minutes later going, wow, how did I end up down this rabbit trail learning so much about that? But I would encourage you to spend that time that you're going to sit with your device, killing time or intentionally investing time to study what is a direct primary care practice and who's available near me and what does this membership-based medicine look like? Can I afford it? Can I budget for it? Because that's going to set you up to succeed when these again, unexpected and really frightening things happen. And if we've learned nothing today, we have opportunities to reduce our stress and anxiety as women, as healthcare decision makers by doing the work in advance and getting those tools together. There are, someone mentioned earlier, the Free Market Surgery Center here in Austin, Texas. There are entire surgery centers that have popped up that create bundled care pricing that is transparent, that is available to you in advance. You know, there are so many new models that exist. And, you know, I know at Sedera, we're happy to talk to people about that. The doctors on the call on the Zoom have the exact same resources available. And just have to start asking those questions, and it really will reduce your anxiety and give you that confidence that you know how to handle an emergency when it happens.
That's wonderful. I think the only thing I would add is just to make a plan and save. I know not all of us have, you know, depending on what's going on in your life, you might need your savings to be directed in one direction or another, but as much as you can start building that emergency fund and make a plan to save, know what your emergencies would cost, know what your urgent care would cost if you needed to go to the urgent care, and plan for them. Put that little pocket of money aside. That's one of the most empowering things that you can do, is to feel secure and confident and not worried that, you know, where will I go? Who will I see? Who will help me on the other line? And also, where will those funds come from? And so make a plan to save. We're releasing a tool in the next couple of weeks to help you navigate and plan for your cost and understand what your costs might be in a given year. If you have never sat down and looked at what your costs are right now, we would highly encourage you to do that. It's one of those scary things you don't always want to sit down and look at. But sometimes when we sit down and do the math, we are spending anywhere from, you know, $13,000, $15,000, $20,000 a year without knowing it on healthcare. And then when you look at the return, it's alarming. And so really investigate where you're spending your money. And if in some of these tools that we are presenting are a good opportunity for you to take hold of, from telemedicine to direct primary care, to these surgery centers, to these mindfulness and healthy lifestyle techniques. There's resources there for you. We do have to wrap up. I know each of these women would be thrilled to share more with you if you had any further questions. If you have questions you hope we answer offline, drop them in the Q&A. We'd love to pick them up later. Dr. Iqbal and Dr. Keller practice at Direct Med, and Jenny and I are both at the Sedera Medical Cost Sharing Community. We're passionate about building a community of empowered women who have a way forward in navigating their costs. So thank you guys so much for your time. Thanks for spending this morning with us, and thank you, Austin Women, for having us.
Thanks for having us.